Good morning. Welcome, everyone. This meeting is being recorded, and that's why we have a little note at the bottom. Let's start with the agenda.
Pete, you just muted yourself.
Thank you. I I entered on the wrong page. Thank you, Mary. Because you're still in the office, right? That's always a good test for between Mary and myself, is we can hear each other in the office, although we were a couple of cubes over, and then we know if somebody's muted or not. So welcome. For those of you new, this is a monthly webinar that we do. We try to inform you about some of the systems and how stuff is going. And we record them. It's every first Wednesday from 9 to 10. And if you won't be able to manage to get through the whole presentation and you want to check it out later, or you have some coworkers, we have it recorded and you can find it usually within a day or two on our website. It might be a day or two longer because Kayla's not here today and she has that working like a charm, but she should be back tomorrow and taking care of things. So why don't we start with showing you who the team is? Click. And it's Kayla, but she's not here today. She had other things to do, and unfortunately, she couldn't be here. Cecilia is somebody you might know from her voice, and this is a little picture of her, and she is one of our support specialists, together with Mary and myself. I'm the senior systems analyst, and I also am pretty busy on the behavior health data warehouse currently. Jody, of course, everybody knows her as our MOTS EDI specialist. Justin is our report specialist, but moving in transition into different functions, and Anna is taking over that report specialist task for the MOTS team, and in the future, the roads team. Okay, let's get going, see what we have on our agenda. Why do we do this? Well, most of you will know, but things happen, things change, the systems come, systems go, improvements are made, federal rules, government rules change, state rules change, and with that, all our systems change. So if there are any changes, we like to use this forum to inform everybody on what is happening or how soon it will happen and how it will impact you. If there's any data issues going on, sometimes we notice that there's a certain trend that looks off or looks like it's influencing everything. And we like to discuss it here and maybe inform you guys what we see. And then hopefully you can respond and work with us to give us information, get feedback, and see if we're seeing things right and if those trends are actually happening. Ideas for future webinar topics, always welcome. If you think something needs attention or needs to be talked about in a more in-depth matter, then please let us know and we'll put it on the agenda. And hopefully, if there are any questions, we can answer them here, or if we can't answer them here, then we'll definitely find someone who will be able to answer them. Okay, and any news? Well, the big news is that the resilience outcomes analysis and data submission, I have to repeat myself a couple of more times before it's in the back, the road system is currently in development cycle number 3, and that is in progress. And the go live has been postponed, unfortunately. And we'll have an extra slide on that in a little bit later in the presentation. The same goes for the MOTS reporting administrative pause. It's going to end, and we'll talk about that a little later. For those of you who have not seen the change in the email, it will automatically go through if you have the old email, but you might want to check and update the MOTS support at odhsoha.oregon.gov. It always used to be .state.or.us, but the whole state has changed to the .oregon.gov. The same goes for the roads, the new system that will be in the future replacing MOTS. It's roads at odhsoha.oregon.gov. And then we go to the next, and we're going to give the microphone to Mary, and she's going to talk about a new value that has been added, fentanyl. Go ahead, Mary.
Good morning, everybody. So this is a short announcement. We've added fentanyl to the substance abuse code table, and it has MOTS code 20, and it went into effect as of June 15th, 2023. So now you'll be able to report fentanyl. So thank you.
Thank you, Mary. Yeah, the MOTS code 20 is for the EDI, and the description you'll see in the dropdown when you select a drug in the drug matrix into the CE system. So great, thank you. And we go on to the next slide, and that is the administrative pause update.
Awesome. Thanks, Pete.
There you go, Jody.
Yeah. All right. Well, it's been a long 3+ years for all of us as we, made our way through the COVID pandemic and all of the things that happened or that we paused or didn't happen. And so things are starting to kind of return back to some of the ways they were pre-pandemic. So one of those things is the administrative pause, which most of you know as the pause in having to report your 90-day updates to MOTS, and a few other things have been slated to start back up and resume on October 2nd. So obviously, during the pandemic, a lot of reporting requirements to include MOTS were scaled back. And now that the public health emergency has officially ended, regular reporting is going to resume. Um, the administrative pause, as I said, October 1st is the official time the reporting pause will end. And what it means by requiring for providers to resume MOTS standard reporting. Pete's going to go over some of those timelines in the next slide, so I won't hit on all that. But what I will say for sure is that your 90-day updates will resume, and those were basically once you let us know somebody is in treatment, then at a minimum of every 90 days, you let us know kind of updated values, what's going on with them. And if they discharge, it has to be done by that 90-day update. I know a lot of you do it sooner, which we greatly appreciate because that really puts it more into alignment with real time what's happening. I do see a few names on here that are EDI, even though this is a client entry webinar. I will say that the pause, and for many of you that have submitted through EDI, may not be that impactful because I know a lot of you all just kept doing the processes that your systems were set up to. So if you're wondering if that may or may not impact you, please feel free to reach out to me and MOT support separately, and we'll be happy to help you figure that out. So with that, Pete, I'm going to turn it over to you for the next one so that you can go into a little more detail to refresh us all on cadence of reporting.
Thank you, Jody.
Yeah.
Yeah, Jody hinted at it, and it's exactly true. Just the standard cadence is that any new client starting treatment who is admitted to any of your programs must be submitted to MOTS within 7 days. And we give a little wiggle room once in a while because sometimes they're not always there. You don't have all the information, and it takes a day or two or an extra day here or there. And we don't have a system blocking you if it's longer than 7 days. So, but please try to get within the 7 days. This also goes for any crisis and involuntary service events. They must be submitted to MOTS within 7 days. And we get a lot of questions about the crisis because it is hard to get all the information from an individual who's in crisis. And especially if they're new and they're not a client yet, then it might take a little while. So as I said, there's always room, there's always wiggle room, there's always room for exception, but please try to get it within the 7 days. So the non-Medicaid services must be submitted within 30 days after the month in which the service was rendered. And the reason we're saying that is because we have the additional tool in the system, in the MOTS client entry tool, that you can do all your services that are exactly the same that you provide on a group session that an individual attends twice a week. Then you don't have to put 8 different services in there. You can just fill out one, use the calendar to get to the other days, but then you have to be in the previous month because you can't submit any services that are happening in the future. So that's why we say um, within 30 days after the next month. And I know for EDI, it's usually in mid-month when you do the previous months when they submit the files. But for the client entry, we say, okay, try to do it uh, in a month and then do the previous month if you have all the information. The status updates, that is just see if anything happens, and you guys know that better than we do. If an individual got his job back or a job change or changed housing or got the children back or got back together with the spouse or not, or got divorced, something, all those things. The housing situation, living arrangement might have changed. There's all kinds of things that happen while individuals are in treatment, and we'd like to get those updates. And for a while, we kind of said, well, if as long as we get admission and discharge, we're good. We kind of went back to the old CPMS system that we had before MOTS in end of 2013. So we did change that. So, and now it's going to be back on October 1st. So at least every 90 days. As Jody mentioned, of course, that when you work EDI and you have a system set up that automatically pulls information on a weekly, monthly basis or something like that, just work, leave that, because if it's working, then if it ain't broke, don't fix it, and just work it like that. So. And the end of a treatment episode should always be reported within 30 days. We give you a couple of more days because sometimes it takes a little while to get all the information. We have been told to get everything so you can close the treatment episode. So the end of the treatment should be reported within 30 days. Okay, that is kind of like the standard, and we thought we'd reiterate that one more time. And then we go back to the roads go live date. Yay. Go, Jody. Thank you.
Yeah, thanks, Pete. And also for anybody, if you've got questions, because some of these subjects might, trigger questions or whatnot, feel free to drop them in the chat. Those of us that are here will try to get to those. Or we'll, we may have you just come off mute and help explain what your question is. So, as Pete mentioned, the roads go live date has been rescheduled. We have moved that date that was originally set for December, early December of 2023 to April of 2024. I know we're all excited about moving and going to the new system, but there's a few factors that we looked at to try to make sure, like, is this date really going to be reasonable? Is it going to be as meaningful and deliver the things that we need to? Should we, should we take a little more time to add a few more things in? So the decision was based on a few of these factors below. We obviously are trying really hard to reduce your administrative burden. And that basically is the reporting outside of MOTS, whether it's to other organizations on behalf of us, if it's manual, email, spreadsheets, all different forms. We've and the duplicative stuff that you're having to send. So that was one of our big reasons, because giving us a little more time has allowed us to bring more things into the road system. So we have a nice smooth transition to the new system. It's going to include, as I mentioned, additional functionality. Mobile crisis was already slated to be in the road system on the December 2023 date. But with looking at April 2024, we were able to put into our roadmap the functionality to collect the additional kind of around crisis and mobile crisis, but the 988 stabilization services. Many of you may hear of. Sometimes if somebody's has a mobile crisis situation and they meet a few of the requirements to be in the stabilization services, they kind of get those as well. Quite a few data elements to collect. So those will be included. Measure 110, some of you may heard of Measure 110, a lot of folks have heard of, but also burn networks. There's various networks throughout the state that have formed to provide services as a collective of providers or as single providers, depending on some geographical areas. And so the Measure 110 data elements will be included in the April 2024 Go Live. And we also are in adding some improvements for non-EDI data submissions. So you're probably like, okay, well, what is non-EDI? Like we have the web portal, client entry, or we have EDI. We've heard over the years there's many different software programs on the market available in the behavioral health realm. Some are tailored for certain types of services you're.
We lost you, Jody. You broke up. Not sure what happened. I don't know if you lost connection or not, but I'm not hearing her. Mary, are you hearing Jody?
Oh, now I'm
You,
back.
there
Sorry.
you go.
Had a little pause in my bandwidth delivery, evidently.
Oh boy.
So, anyways, so the options for improving on EDI data submissions is essentially those programs, software programs that you may have that haven't built out the full EDI file specifications, interactions. We're looking at some options for a hybrid. We've heard from many of you like, hey, could we give you an Excel or a .cvs file that just has certain things in it? Could we do part of it that way instead of having to manually enter? So we've heard you, and those are also things that we are looking to have available in April of 2024. So I think that's super exciting. Now we understand that there's a lot of providers. I mean, I get anxious about the whole thing as well as others. In order to prepare for our transition, do appreciate your patience, knowing that we've adjusted the timeline again for you. The With this project timeline shift, we will be looking at the specification dates to provide what we're calling the EDI file roads version 2, because roads upon go live at 2024 will consume legacy MOTS EDI files. So there won't be any change there. And that will give time get the new version 2 implemented by your EHRs and whatnot. So originally the date was 8/15. That's like 13 days away. So we're looking to try and shore up exactly when that date will be. It will be before the end of the year is the expectation. As we know, it's dev time cycles and all of that have to be done for you that have EHRs. And also, the ones that might do some non-EDI data submissions that are like our hybrid model, you'll be able to learn about that. Um, we are going to be having more provider engagement sessions. I know you've been hearing this for a little bit, but we will. Kayla is working with our teams to get those set up. And then we're also going to be looking at the training and getting a new announcement of when those type of things will start rolling out. And I know we were looking at a go live of December. From Thanksgiving through the first of the year, there's a lot of stuff going on. Folks are busy, there's vacations and things like that. So actually with the April 2024, hopefully we'll be in a better spot for training, the retention once we go live, all of those things. We are also going to be considering doing some beta groups, or some folks that will kind of be our testers and work with us before we go live. So if any of you have a, passion to maybe want to plug in and help us with that web portal piece, or you feel it would be helpful for your organization to do so, please reach out to Mott Support, and Kayla, Mary, all of us will take a look at that, and we will greatly appreciate the involvement and help when we get to that point. So, um, with that, do we have any questions at all in the chat, Pete? I don't.
I'm not seeing anything pop up, so I think you were loud and clear. And
Okay. Well,
as you mentioned, Thanksgiving through Christmas and the New Year is always a busy time, and sometimes it is that period is chosen to get a soft transition. That means because it's not very busy, there's not that much information coming in at that time, because otherwise you might have a huge wave coming in, and that's I think why we decided to start December 5th in 2013, because we figured then we can kind of start trickling in the data and coming in that way. So there's different ways of thinking about how to do things. So, but this is currently the decision to say, okay, we'd like to wait till after we're in the spring and we're in a different position. So, thank you.
Yeah. Yeah. I heard somebody coined it or said something the other day that was like, um, nobody remembers as much if you met the date than if you hit the mark. So that's what we're really trying to balance is getting everything in there and getting it out to you and having great success for us and all of you reporting and our clients and stuff. So thank you all again for your patience in advance. Okay, Pete,
I'll pick
I'm,
this one
I'm
up,
gonna,
Jody. Now
oh,
I'll give you a
okay.
little break so you can
Thank you.
rest your
Okay.
voice for a little bit or take a sip
Well,
of coffee or something
they'll
for the
probably be
next
like,
one.
oh, nice that she can let us hear someone else.
Yeah.
Uh,
Okay, new to MOTS. There's still its system is still going strong, and if you're new to MOTS, and especially new to not just the system but also the behavioral health data, and that's one of the things that we like to introduce to everybody. So, what Kayla started doing, and on a regular basis, is every second Wednesday of the month from 10 to 11, she starts a Welcome to MOTS event. She has an hour, and everybody who is has new coworkers, is new to the system, just started in the business, worked with other systems, but maybe not with the MOTS, so not really familiar with all the data. And we have this whole hour she has set up, and she will be there. And I think usually Mary is there to help out, and she's doing a big chunk of the work, I've heard also. So thank you, Mary, for that. Um, it is for new users to get help on how to easily do things, and if they have questions on why are we doing this, because all that information is there. So it's kind of like an introductionary hour that we have every second Wednesday from 10 to 11. 9 o'clock was a bit too early. Kayla likes to sleep in a little bit, so 10 to 11 was a good time for her. So if you have anybody new, anybody in your office, or you just need a refresher because maybe your focus has been on other work and you're back into the swing of things and you know mod enough, but it's always nice to see if anything has changed over time or if there's anything that's happened, and then you can use that hour to just chat and talk about things, all things mods. We have that hour available for everybody. Okay, and then Jody had her coffee sip, so now she's back to switching from CE to EDI. Go ahead, Jody.
yeah. Thanks, Pete. So, um, as Pete mentioned, MOTS is really going strong, and we're doing a lot of work to have the similarities from MOTS to Rhodes, and also, some great differences. But if you are considering switching or looking at a new health record system or whatnot, make sure that there's a few things that you do. It'll still be important because MOTS and roads are going to be very similar. And we're taking that into account. So if you're going to think about this, maybe let us know. That's the first best thing you can do, even if it's, maybe 3 months, 6 months, a year, or maybe you're like, hey, we're going to get this thing out in 30 days. So whatever your pace is, that notification is going to help us set our teams to where we need to be to help you out. If you're looking at electronic health records programs, MOTS functionality is when I say that, it's really kind of some extra set of questions because many times the a system might be, have MOTS functionality in it, but how does that actual process work? It has seemed helpful from feedback or lessons learned that we've heard from other providers to kind of find out like how does when they're getting a demo or you're looking at things, how does it work to get your client from the time they come into your building until you get that thing submitted to MOTS, and how much staff time will be required, who's going to do what. And I put that in there just because there's a kind of a misconception sometimes that everything is just like 100% automated. And that might be the case, but it's helpful to really understand that. So there will be some folks who probably still are plugged in doing different pieces, and knowing who those are going to be and how much time it'll take will really help you in your project as well as once you're gone live and you're doing your day-to-day stuff. There's no one way that's better than another. There's just differences. That's why we have our EDI specs, and each system gets to build to those. So yeah, project timing is super important. Notifying us, we just tie those two things together. We'll know what your project's going to look like. There's going to be a process for changing you from the web portal entry to sending them through EDI. But we've been doing this about 10 years now, or I've been here 10 years almost. And so we've got it nailed down. The secure file transfer is a location on one of our servers here at the state where either you, your system, or a process will send your data files to us. So we set that area up to make sure everything can come and go as it needs to. We also will talk about your client IDs, depending on if your new system is going to require us to update your current ones, or kind of how we're going to structure that facility or that setup. And also, we do testing for providers at a provider level. So you might be looking at a system, or, and you're like, well, hey, they already have, 10 providers using this. Why do I have to certify? And the reason for that is to make sure that your individual and customized setup within whichever system you get, that all of those pieces have been mapped appropriately. You might have special forms, you might do some customization to make your business flow better. And we just want to make sure that all of that data alignment in the background that comes in through the file is correct. So we've got it nailed down as well, and it's pretty standard. So we'll get you through it, no worries. You're going to go live, and then we're going to do some follow up. And the follow up really is as much or as little as you need. We just want to make sure that if you're changing from CE to EDI, there'll be some differences once you're actually up and going. And we want to be available as needed to help you uh, through that journey. So, with that being said, this is kind of like my boilerplate, but these are just super important things. At a minimum, just let MOTS support and us know that you're thinking of doing something, and we will help guide you from there on what we feel is important to make your project a success. So, Pete, I think that is that.
Thank you, Jody. Yeah, that was it.
All right.
And that concludes our webinar for today, our PowerPoint presentation that we had. And you might have noticed the trend that they are not as long as they used to be because we're in a transition phase and moving stuff to another, and a lot of things are still up in the air. So a recording of this webinar will be on our site, and you can find it under webinars and newsletters. We also still bring out the MOTS Messenger on a monthly basis, and you can also find that out there in the newsletter and future webinar dates, because our next one will be September 6th. That is the next Wednesday of next month, the same time from 9 to 10. And I'm checking the chat and I don't see any questions. And I'm not hearing anything. So again, thank you for joining us. Have a wonderful rest of your day and take care. Bye-bye.
Thanks, everybody.
Bye.